Everybody, my name is Paul Charlton, and I'm a patient member of our study management team. As our presentation today is about the relationship success of our approach to involvement, that is being a kind approach. We felt we would present as two sets of conversations between a patient and a researcher. So firstly to Katherine and me.
Hi everyone, I'm Katherine Fowler and I'm a Research and Grant Coordinator at East Suffolk and North Essex NHS Foundation Trust and also a study management team member.
So what is our study about, Katherine?
So this study is an observational study. What that means is it doesn't involve any drugs or any interventions, and it is purely exploring the symptoms that people have experienced when having long COVID. And we're looking particularly in our local region. Our NHS trust covers Suffolk, part of Suffolk, and also part of Essex.
And when was patient involvement first discussed in the design of the study?
So at one of our research assessment team meetings, where we discuss all of our projects within our research and development team, we discussed the initial concept of a long COVID study. And obviously patient involvement is the first design principle with any research. So I advised that patients needed to be fully involved from the start and also need to be on the study management group, and the clinical director of research suggested that the best person to contact was yourself, Paul, as Paul is one of our PPI, so our patient and public involvement champions at the Trust, and Rebecca, our study principal investigator, then contacted Paul. How did Rebecca approach you, Paul?
Rebecca emailed me in November 2020. The study wasn't due to start until the May of the following year, 2021. So that was a good time gap for patient involvement to influence the study design. Rebecca's email was written with a really friendly, actually, and open approach. So I dived in.
That's exactly what we wanted in terms of when we approach our patient involvement in our studies at the hospital. All the trust are determined to ensure that we reduce any barriers to people contributing to research. Central to that is that we develop relationships with people, co-produce our work, and develop trust between people. This is one of the UK standards for the patient and public involvement. So part of the UK standards for patient and public involvement. So we wanted to put that to work. So how did your role develop, Paul, within the project?
Well, in my first conversation with Rebecca and Kate, I did actually query the capacity of the study design to meaningfully answer its question. That was a challenging question to ask, but Rebecca and Kate were very open to having that challenge. Rebecca and Kate were actually already well forward in creating long COVID patient involvement, because I don't have long COVID, to inform the study design and delivery. Our first shared work then was co-producing a survey to collect local long COVID patients' thoughts on how the study team should contact people and whether they had any additional suggestions or comments to make about what the study should be asking.
So Paul, you became a mentor to Nicola, a long COVID patient who joined the study management team. Can you tell us about that?
Well, Nicola had independently contacted the study team and asked if she could help at the same time as I was being approached myself. So I suggested that Nicola join the study management group and that I support her as a patient involvement mentor. Nicola and I spoke on the phone before the first study management meeting. We spoke after it. In that first meeting, Nicola did therefore feel comfortable and did speak freely. I've continued to interact with Nicola offline from the study, so our conversations can take us freely to wherever Nicola wants.
So what is the key learning point we need to share in terms of the shared study experience that we've gained from this particular project, Paul?
Undoubtedly, patient involvement in research is at its best when we create the right conditions for co-production. Applying a research culture so it becomes kinder. with a focus on the development of relationships. Standards is an unwieldy word because it's people who need to practice them. It's for us therefore been all about how we went about building a relationship of kindness towards one another, from which standards then naturally flow. Being alongside Nicola as a mentor meant she could swim so much more easily, and so realise the benefits to patients of our involvement in the study.
Thank you, Paul. And because of the approach in terms of involving people within our projects, we've also learned a lot from this project. So, for example, from Paul and from Nicola, who we'll meet shortly, they suggested to put people's pictures into patient information sheets. Information sheets as well as introductory emails, and it just makes it so more personable and real, so that behind that information sheet, behind the researcher, is actually a human being there, and we're using that forward for our future research projects. So thank you, Paul. So Nicola and Rebecca, it's to you.
Thank you, Katherine. I'm Rebecca Impson. I'm the principal investigator for the study, alongside Kate Harrell, who's the chief investigator. Now, Kate and I are both allied healthcare professionals, so I'm a physiotherapist by background, working with older people, and Kate is a speech and language therapist. So in our clinical work, we naturally involve patients in their treatment. We are always setting objectives with them about what matters to them and where we want to go with our treatment. So for us, it was just natural that we would involve patients in the design of our research project, especially in a novel area like long COVID, where nothing was yet known. So after I'd approached Paul and he'd offered his advice and support, we also approached a few patients that we were working with after their discharge from hospital, who'd been in hospital with long COVID, that the therapy teams were working with at the time, and just asked for their feedback on some of the questions we were proposing to ask to participants and the study design. But at the same time, Nicola, you'd actually approached the research team to kindly offer your support and involvement, and which was fantastic. What was it that made you approach the research team?
Well, I'm a long COVID sufferer from the first wave. It was a bit of a unique experience to have an illness that no one knew existed. And I was part of the growing grassroots long COVID community. There was massive frustration about not being listened to or believed. I got to a part in my recovery where I was able to start a very lengthy phased return to work. And I contacted the team to see if I could help in any way, bringing with me the collective experience of the long COVID community.
Yes, and so initially it was actually Kate that you met with, and you looked at the questionnaire with her, the questions we were going to ask participants. How did you find that?
Kate gave me a really safe environment where it was easy to communicate. I felt trust, no judgment, and it was an honest and open relationship. I was able to speak freely and tell my story along with the others' experience from the long COVID community. I was able to make suggestions with the illness and the challenges that presents in mind, so that the data would reflect people's experiences and be meaningful.
Yeah, particularly I remember, Nicola, that you had some issues with the anxiety and depression scales that we were planning to use. You felt that they weren't useful for long COVID sufferers and that they didn't really indicate how you felt about things. And so that was really helpful, because we took that away and went back to the clinical psychology team at the hospital saying, you know, this is what we've been told, what sort of alternatives are there? And they came up with a few alternatives which we took back to you and we're subsequently using with the participants in the study. And that's been obvious from the feedback we've had from participants, that they really feel that, you know, the questionnaires that we're using are able to really show and how they're feeling about things, and really are indicative of what they want to get across. On top of that, we asked you to be involved and sit on our regular trial management group, and we put you in touch with Paul and the Paul's suggestion. How have you found that?
Having a mentor was really invaluable. Paul gave me support and a guide in a new environment, and also gave me someone to seek clarity with away from the rest of the group. So it was just really, really beneficial.
That's great. And part of the ongoing trial management group, you've been instrumental with the processes as we've gone along in the study. I know that you've influenced us to send out a questionnaire booklet to participants pre-interview so that they're more prepared. And you've helped us sort of set up in the recruitment stage different emails to send to patients that made it easier for them to respond with just a yes please, for example. How have you found that involvement in shaping the process of the project as it's gone along?
For me, it's really important that the researchers understand the illness and the challenges that it presents. So, like you said, the examples using big fonts and more white space to help with the cognitive issues. And for me, it's about removing the barriers so that people that want to participate can tell their story.
Yeah, brilliant. Thank you, Nicola. Honestly, you've made such a difference to the study, and I thank you for your involvement. You've really made sure that we can enable patients to contribute and really capture the experiences that they're actually having and the impact long COVID is really having on their lives. So thank you.
That's all right. I feel that it's been such a collaborative experience with a respectful working environment where each individual in the team is valued. I personally have felt really reassured that people are listening because of the direct changes that have been made after my input, and it gives me great confidence and makes everything feel extremely worthwhile. So thank you to the team as well, and thank you back to you, Sylvia.